Hi from healthvideos.a-to-z.com in Bali and Singapore. If you're depressed or bipolar, I want to help you find and fix all of the causes so you get fully better. There are nearly always several problems underlying depression and bipolar disorder, and antidepressants usually help but rarely fix everything. I was a family doctor for 46 years, then had my own busy drug and alcohol clinic for 5 years, and cared for many people with depression and bipolar disorder. Those people almost always had several distressing factors that had accumulated, then something else happened that tipped them over into depression or high-low swings, and they didn't ever get fully well until all the factors were found and fixed. But finding everything through usual consultations was so slow and difficult that often some things weren't fixed and many people never got fully better. I found what worked best was asking people what they wanted and needed, or needed to get rid of, to get a better life, then turning those questions into the what I want need checklist. Adding simple help mind-body workouts helped further. In 10 minutes, anytime, anywhere, even on your phone, go online and click on your choice out of 4 possible scores for each what I want need checklist question. The checklist program then gives you an instant report that tells you which of your wants, needs, and don't wants you chose the highest scores for, and advises you which YouTube videos you can immediately watch that will help you most with those particular wants, needs, which medicines usually most help those wants, needs, and which wants and needs are usually helped by self-help mind-body workouts or counseling. Often repeat the checklist, watch the videos, do self-help mind-body workouts, and fix new problems early before they cause more problems. A global study showed that of the over 30 antidepressants available, the 4 most effective were morning-stimulating desvenlafaxine, evening mirtazapine that also helps sleep, and escitalopram and sertraline that can be taken at any hour, and those 4 work best for my patients. If after 2 weeks on an antidepressant there is no improvement, ask your doctor about adding a second antidepressant, a morning and evening antidepressant, or taking a different antidepressant. If you're sleeping poorly, chew and suck a mirtazapine tablet at bedtime. For severe no energy, can't get out of bed depression, add non-addictive stimulating Modotrex to morning desvenlafaxine. Pocket Modotrex 60 powder dispenser has the advantages of giving fine-tuned doses of stimulating non-addictive modafinil and containing low-dose naltrexone that boosts your brain and gland production of natural internal feel-good endorphin chemistry. Start with 1 dose of Modotrex on morning waking and increase by 1 dose daily until it feels just right, but not more than 1 dose per 14 kilograms or 30 pounds of your weight. Too much loud talking, speedy high mood and energy, going very fast and taking risks, not sleeping, or getting very intense, irritable, angry, or violent indicate a bipolar high, which requires a mood stabilizer such as carbamazepine CR or lamotrigine, or a major tranquilizer such as aripiprazole. When there's any sign of a bipolar high starting, no matter how good it feels, stop Modotrex and desvenlafaxine until it passes. If you've ever had a bipolar high, take very great care to avoid the stimulants nicotine, ice, cocaine, and ecstasy, which can be very tempting when you're low, but can trigger dangerous highs and make your life chaotic. Severe bipolar highs can trash your life, even causing unemployment, bankruptcy, divorce, or homelessness. So learn to tell when highs are starting and how to quickly stop them. It's far easier and safer to stop highs early than late. Then learn what causes the highs and how to prevent them. Sometimes when highs start, people feel so good that they refuse calming medicines and then get into very big trouble. It's best to carry a powder mood stabilizer or major tranquilizer in a pocket powder medicine dispenser everywhere you go so you can dose in seconds, anytime, anywhere. Get full blood tests done and correct any factors that can add to depression. Boost low vitamin D with half an hour of sunlight daily or vitamin D capsules. Boost low vitamin B12 with methylcobalamin sublingual tablets or sardines, mussels, clams, oysters, or octopus. Your B12 cell levels can be deficient even when your blood tests are low normal. Lift low magnesium levels with magnesium threonate, which gets into your brain better than other types of magnesium. Get omega-3 oil from 2 dessert spoons of flaxseed daily, ground up or swallowed with water. If sluggish, depressed, feeling the cold extremely, and overweight, see the video Thyroid Gland Disorders at healthvideos.com and read the thyroid chapters in the LDN book. T3 cell levels can be deficient even when blood levels are normal. If depressed around childbirth or menopause, get hormone advice from a hormone specialist. If your blood CRP is above normal, inflammatory chemicals will be adding to depression. See the low-dose naltrexone LDN video at healthvideos.com. Get checked for inflammation of the teeth and gums and for signs of autoimmune disease. Eat in anti-inflammatory foods and read the books The Inflamed Mind and How Not to Diet. See the video Cut Suffering and Addictions and Function Much Better with simple mind-body workouts at healthvideos.com and get good at solving problems that arise as soon as possible before they create more problems. Please watch this video several times and go to its text at healthvideos.com and click on links of interest. If possible, spend 10 minutes now at healthvideos.com doing the What I Want Need checklist. The checklist instant report explains which videos, medicines, and counseling therapy most help the particular wants and needs for which you chose the highest scores. healthvideos@gmail.com have contact details for suppliers of low-priced pocket powder medicine dispensers worldwide. From international Bali and Singapore, I'm keen to pass on helpful information to distressed people and their carers anywhere in the world. Please leave comments and questions below. Best wishes and good luck from healthvideos.com and the Fix Suffering Early, Simply and Safely system.